Hey everyone, Dr. Testosterone here. Today's video is actually going to be about something you probably have never heard of, and it is a very, very important topic, especially for people in fitness, people who are looking to boost testosterone, people who care about their sex drive and erection quality and day-to-day energy levels. This is a very, very important video. No one is going to inform you about the information I'm about to give you. The topic is neurosomatic therapy or neurosomatic studies. So neurosomatic therapy is a type of therapy which is like massage therapy, but they use neuroscience knowledge. They use knowledge of bodily distortions, asymmetries, how to treat certain muscles by going deep, and also trying to understand how the body is imbalanced and correcting those imbalances. So now I'm in St. Pete. I'm training here, and what I found is there's a Center for Neurosomatic Studies, and they train. It's a school, and they train professionals who are known as neurosomatic therapists. So I've been going to a neurosomatic therapist for the last 2.5 months, about. Okay, and this is the only school in the world. And there's one other neurosomatic therapist in Manhattan. So there's one in Manhattan and one here near St. Pete in Clearwater, Florida. Now, why is this so important? So when I first started doing deadlifts and squats, what my trainer noticed is as I was moving up to do a squat, my body would kind of distort to the left. Okay, and I was like, why the fuck is that happening? What's going on here? Why this asymmetry? And he kind of told me you should go see a neurosomatic therapist because we have one right here and everyone's being treated by them. So I went, and what I found is that I had a difference in my leg length. This actually happens to 60% of people. So essentially, my right leg is shorter than my left leg by 6 millimeters. And more than 6 millimeters, or right around 6 millimeters, happens in 60% of human beings. So what is happening is because one leg is shorter than the other, just because of how you were born, or maybe something happened in your life where things just started growing the wrong way, you're gonna have a lot of weight on the left side. And when I got my x-ray done, what they found is that there's an SI ligament on my left side, and that had a lot of pressure being put on by my upper back and my upper body, basically. And that is especially not good for future, and it is especially not good if you're strength training and lifting heavy, because then what's going to happen is your body has to compensate and you're going to have a lot of pain. So I had a lot of pain in my hip flexors, I had a lot of pain in my lower back, in my around my knees, so my what is it called, vestis medialis, vestis lateralis, these muscles around the knees. And then I started getting neurosomatic therapy once or twice a week. And what I found is that my pain went away. What I found is that the distortions that I was feeling when I was doing squats, especially, and even deadlifts, or any kind of functional movement that requires the whole body, that started becoming better. And they taught me how to stretch the right way. This is also something very important that you need to do. If you're not using foam rollers, if you're not using lacrosse balls, and if you don't even know what the fuck these words mean, you need to learn, and you need to stretch very well your muscles, especially muscles in the lower back, your hips. There's specific exercises that these neurosomatic therapists taught me about how to exercise my hip flexors. There are muscles deep down inside in your hips, in your lower back, that you can't even access through working out. And if these stay idle for a long time, and then you work out, like you strength train, you do some kind of crazy CrossFit workout, or you do something that requires your whole body to move in ways that you never moved before because you were sitting down your whole life in a computer and typing away like an accountant or a computer programmer, like I did in grad school for 14 years, sitting there and became aged. My body became really aged, man. Like I was feeling pain during these workouts and afterwards, like massive pain. And then I got a leg lift. So I went to a leg lift person. It's a little sole that they just put inside of your shoe, and I got a 6 millimeter leg lift. And now that I've been on the leg lift for 2 months, the pain has gone away. I've learned how to stretch, so I'm not feeling that hip flexor pain that I used to when I woke up in the morning. I am not distorting in my squat when I do them. My deadlifts have improved. My gains have improved. I can lift way more. I can go 6 times a week with very rigorous workouts. I would say that all of these improvements in my physical fitness training are due to going to this neurosomatic therapist and doing neurosomatic therapy. I would recommend any of you who are watching this video who've never gone to a neurosomatic therapist, fly to Clearwater or Manhattan. Clearwater is located near me. Come see me as well if you want. I would love to have coffee with you and at least see this neurosomatic therapist once. And it will change your life. You will learn a lot. Today I had one of my friends, Jibin, who's a neurosomatic therapist. He worked on my eye. I've been having a lot of problems with my left eye, corneal erosion. It's from an injury that happened a year ago. He can even train my eye. Ophthalmologists don't even know that you can train eye muscles to become stronger and improve your vision. The CEO of this CNS here, Center for Neurosomatic Studies, he told me an 85-year-old woman came in. He worked on her eyes, and she said that the world became more vibrant. The world became more visually appealing, and she was seeing the environment like she's never seen before. So I highly recommend this. Comment below if you suffer from pain in different parts of your body, and if you actually stretch after workouts and warm up correctly before workouts. Would love to know that. And any question that you have, let me know. Post in the comments below, and I will see you next time. Make sure you warm up and stretch after a workout. Bye-bye.